Are you experiencing painful sex after menopause and don't know how to talk about it even to your doctor? You're not alone. Thousands of women suffer in silence because they're embarrassed to discuss vaginal atrophy. Thank you for joining us for another segment on Second Act TV. I'm real happy that Dr. James Simon stayed over with us for a segment that is really difficult for some women, a topic for women to discuss. I know I was one of them. I want to treat this segment both from a clinical perspective, but also talking to you as a man talking to a woman, because this is a big issue. As a woman, I know I was in that situation where I wouldn't want to bring this up. There's something wrong with me, or maybe my partner, my husband, thought that I didn't desire him. Do you hear this from women? Will they talk to you about that openly?
Generally, they will in my office, but that's because I prompt them. And I have a very easygoing style, if you will, that kind of drags it out of them. But I think your comment is very apropos. Most women are embarrassed about it. They think it's a natural thing to go through menopause, and this is just part of natural aging. Maybe their mother had pain with sex and they were told that this is just have to deal with it and whatever. But the way I take care of that is to be proactive. And in fact, I ask every woman, whether she's 20 or 80, A, if she's sexually active, and B, does she have any questions about sex? Is she having any pain, etc.? And if you've been a patient of mine for a while, you've had that every year for a while. And, when you get to be 50 or 51 or 52, it's no big surprise because last year and the year before you had the same questions.
It's true. The more you talk about it, the more normal it gets. That's one thing that I've learned, having produced the show for the last few years. What I'm talking about openly right now that I would never talk about in private is it surprises me. And, it does spawn conversation with other women. But what is the best fixes for it? Because it can make, I know that hormone replacement made a huge difference with me. How do you go about treating it?
So first is to get it out in the open and to tell women that it's natural that she have some decrease in her normal secretions. That is to say that her vagina may feel dry, especially dry when she's having sex, but always what I call walking around dryness. The other is to explain to her that pain with sex will ultimately occur to her unless she is proactive about taking measures into her own hands. And most of the women who actually come with the complaint, as opposed to my initiating the conversation, they've already tried over-the-counter lubricants or moisturizers, and those are not the same, or some other treatments to help their vaginas become more soft and supple and the way they were when they were younger.
Mm-hmm. What do you, for somebody that's watching the program right now and they're going, oh my gosh, that's me. So what should I do? What's my first step? What would you say?
So I think the first step is to understand that what we're talking about is normal. That doesn't mean you want it, but it's normal. Okay. You didn't do anything bad to bring it on. It's part of normal aging, and it gets slowly and progressively worse.
Then is the best way to fix it to go to your OBGYN, talk about it openly?
So there's no one best way. I would say that we have a number of options for women. You mentioned systemic hormone therapy, and that is an option. So a woman who's taking medication for hot flashes or disturbed sleep or night sweats, that medication usually also treats her dryness and atrophy of her vagina. About 10 to 15% of women who are on perfectly adequate systemic hormone therapy still need something vaginally, something
Okay.
specific for their vaginal dryness or pain with sex. Now, most women who are not using hormone therapy for hot flashes, for example, they will start to have symptoms or dryness with sex that's not adequately treated with an over-the-counter lubricant or moisturizer about age 55. Not right at menopause, but a little later. And it's going to sneak up on her. So she's having sex, it's normal, they use a little lubricant, everything is fine. And then one day, oh my goodness, it really hurt. She didn't tell her husband or her partner, and she thinks the next time it's going to be better, and it's not, and it's getting worse, etc. That person is likely to need a medical treatment for her vaginal atrophy and pain. And they come in a variety of different forms, both local estrogen treatments that have been available in the US for more than 60 years, or there are now some oral non-estrogen treatments that also treat dryness and pain with sex. And these are all available, and your obstetrician gynecologist should know about them or be able to give you good advice on them.
The message, though, is don't be embarrassed about it and talk to your doctor. And if any physicians are watching this, prompt the women, because we are embarrassed. Or we can be. But this is something, taking charge of our sexual health is, if we do it, we can have wonderful, sustainable sex life for a lot of years to come, right?
Absolutely. Don't be embarrassed. It's a body part. It's like the nose on your face. If you had pain in your nose, you'd bring it up. It's just a body part, even though it's a sexual body part. And if it's not working right or you're having pain, you should bring it up to your practitioner. Even general family docs should be well versed in how to take care of this. And if not, seek an expert, either an obstetrician gynecologist or a specialist in menopausal medicine.
Thank you, Dr. Simon, very much. I'm going to hold you over for one more segment so we can discuss getting our desire back once we've lost it, and what some of the reasons for that are. So see you on another segment. Thanks so much for watching. Right here's another video I think you might enjoy. And while you're at it, please subscribe to our channel. Buttons right here. Thanks. See you next time.